Yeah. Has your wife been here today yet?
She has.
Action.
And in 33.
Ladies and gentlemen, that's a good bingo. Clean your car.
So far today.
That's true. Yeah.
I think Benedictine difference is respecting one another. When you do come in the building, you do feel a sense of calmness and kindness. Respecting their wishes and respecting their needs. Seeing their differences, but yet accepting that also.
Every day working here, I think with my elderly population, they're so grateful, they're so kind, and they just can't thank you enough. A person that needs you so, needs help and needs someone so badly. I think just doing the simple everyday things and seeing how happy and how appreciated you are, that's more touching than anything, just the simple things that you do every day.
And I think if we make them feel, it's okay, this is your home, you don't have to worry about anything, it makes you feel good that you're doing your job.
I find appreciation from the people and the staff to be the reason why I come to work every day. The Benedictine difference to me is that we walk the walk and talk the talk.
The Sisters of St. Scholastica Monastery actually began healthcare here in Duluth and in northern Minnesota before our community was officially founded. A group of sisters from St. Benedict's Monastery in St. Joseph, Minnesota came to Duluth and founded St. Mary's Hospital in 1888. And only in 1892 was the community actually founded as an independent monastery. The Benedictine health system founded, as we know, in 1985 to carry on the healing ministry, the compassionate ministry of Jesus, caring for the sick, caring for those who are in need or vulnerable in any way. The core values of our Benedictine health system are, the word core is really in a sense says it, they're at the center. Think of them in a way like a diamond. Each of those core values is a different facet of that precious jewel, that ministry of healthcare. They are absolutely essential to commit ourselves to them personally, but also to commit ourselves to them professionally in our work and in our relationships with one another.
To me, hospitality is when someone comes into your home, you go all the way out for them and you make them feel like this is their home. A lot of them are here to stay. And even if they're not here to stay, we want them to leave knowing that they got the best care here, and that when they leave, they can say, this was a nice place, I would recommend this to anybody. And you guys were very nice to us, and I feel like then we've done our job then, when they leave happy.
To live the values, you will get a reward if you live all for them. And the people who you do care for will show it to you. I just do little extra things for them, or I show these people that I care. When I go in there and I say, well, what do you need today? And some of them say, how can you be so cheery? Didn't you have nothing wrong with you today? I said, well, no, I'm here, aren't I?
I try to be a role model for everybody that works here, that we're all here to do our job and to be good stewards of our time, our money, our product, our people, every walk that we walk in our job and in life. I hire people here at Steeple Point to do a good job. I learned a lesson from an employee that I hired. When I started telling this one employee about our core values, he actually came back to me and said, it sounds like some kind of a cult. I said, well, basically, in life, we treat people the way we want to be treated. We want to be fair, we want to be just, we want to be good stewards, and we want to respect each other. Is that something you can do as an employee here at Steeple Point? And he said, yeah, I guess it isn't that hard. And he turned out to be one of my best employees, and now he's a full registered nurse.
To be respectful to me means to be conscientious, to treat people like you would want to be treated. I mean, it's always good morning, how are you, or, carry on a conversation with them, not just barge in and not say anything, just go about and do what I have to do. Being kind, just little things, helping someone put on a pair of socks, or helping someone get dressed, helping someone brush their teeth, feeding someone, putting our core values in action.
I think that's pretty much what we all try to do, is make them feel comfortable, but in the meantime, giving something of yourself too. Maybe it's just a matter of doing their nails for them, or maybe it's a matter of applying some makeup that they would like to wear that day, or just little things. It doesn't have to be big things. I think it's the relationships that you develop with the residents. It goes deeper than a dressing change or insulin or something. You get to know them as an individual. They get to know you as an individual.
I remember when I was little, we would get the Sears and Roebuck catalog. And I would go through the catalog and I would pick out all of these clothes and different supplies that I was going to take overseas to these countries that, needed help. Now that I'm older, I realize that I am living that dream through this organization. I'm able to help people and take care of people from all countries, from all different cultures. So I'm getting an opportunity now to live that dream. Because of this organization, I'm able to do that.
When I find out, like someone passed away yesterday, we all knew, and it breaks our hearts. In a special way, they all touch our hearts. You have to have that feeling in your heart for them. Otherwise, this is not the job for you. You have to care for people. And they all touch our hearts. Every one of them.
As you begin your work within the Benedictine health system, you begin your ministry within the Benedictine health system, I think it's important to remember that you bring your precious, unique self with all your gifts, with all your growing edges, because we all have them, with all your talents, with your dreams, your hopes, and you want to do that work with integrity and with joy and with a sense of satisfaction, and that you are making a difference in the lives of other people. And you are, and you will. The Sisters of St. Scholastica Monastery are immensely grateful to each of you for all that you do and all that you are in carrying forward our healthcare ministry, living the mission, living the values, keeping the vision alive, which is to make our Catholic Benedictine living communities places where health and independence and choice come to life.